Dr. Pat with Little Critters, and we have Spiky here today. He's an 18-week-old bearded dragon, and he was in today for partial tail amputation. He presented to us initially with skin necrosis and inflammation and ulceration, as well as stricture. And we did do some skin testing on him. He was positive for chrysosporium, which is a fungal infection. We call it CANV. And this is a fungus that commonly occurs in bearded dragons. It can also occur in chameleons and some other reptiles, and will often cause what's commonly called yellow skin disease or yellow spot disease. And very commonly you'll see yellow marks on the tummy or the lighter areas where it's more obvious. He has a pretty normal tummy. His was a little bit unique in that it was more centered on the tail. Commonly in these young bearded dragons, we'll see tail injuries from other dragons that bite their tail, or sometimes we'll see constrictions from a retained shed on the tail. This one looked a little bit different though, so we did do the CANV testing, and he was positive for CANV. The importance of that is this is a potentially fatal infection. It's very serious. It did require that we removed just the distal tip of the tail. It was well above the lesion, and he still has quite a lot of tail left here, and we expect it to heal normally. The rest of the tail and the skin looks very normal, and it's best if you can with this infection to actually remove the affected skin and the lesion. And then they're also treated with medications, antifungals. There are different combinations that are frequently used with these guys. They can be long-term. But again, they're more commonly seen on the trunk and the belly, and that's harder to remove all the infected tissue. We have pretty good hopes for this little guy because we were able to remove all the infected tissue. So that's Spiky, and he's on the mend.